Thank you very much. So now if we can grab our seat, so we can start. Thank you very much. So once again, thank you for being here, and thank you for joining virtually all the people that are connected through our IDB Tube in the country offices and abroad. Why we have organized this joint event? We needed to embrace and really materialize this multisectoral work that needs to be done for make Vision Zero's goal a reality. And therefore, that's why we are here. One quick question, and sincere, I want us to answer it sincerely in our personal and professional way. Are we doing enough? Are each and one of us doing enough, personally and professionally, towards eradicating deaths and injuries on the roads? I'm afraid we're not. I'm afraid we're doing much to contribute, but not enough. We haven't given that extra mile that will make us have real change in everybody's life as a citizen and as a professional in each of our own responsibilities. So I invite you all to absorb as much as you can during these 2 days and reflect on how you can implement and take to your different countries and your jobs, your daily work, all the experiences that we're going to learn and the cases we're going to hear about during these 2 days. With that said, I'm honored to welcome President Moreno to have some introductory work, before thanking him sincerely for all the support and motivation and commitment for road safety in Latin America and the Caribbean. So please, Mr. Moreno.
Well, thank you very much, and good morning, everybody. And it's a true pleasure to welcome all of you here to the IDB and for this Vision Zero and Innovation Workshop. This event, as you all know, is the result of a joint effort with all of our partners, the International Road Assessment Program and the World Resources Institute, and I'd like to, again, welcome you. Our goal today is to share the latest design and policy ideas that can help us reach a Vision Zero goal, not accepting deaths on our roads. The road safety decade of action is almost over, and yet, despite our collective efforts, we have not been able yet to reach the goal of a 50% reduction in traffic fatalities. In Latin America and the Caribbean, we still have almost 120,000 deaths every year. And we haven't yet been able to create that sense of urgency that is needed to prevent this catastrophe. And there's no other way to describe this phenomenon when you consider that the total number of people driving from road traffic injuries every year globally, 1.3 million, is comparable to the number of people dying from all natural disasters over the last 20 years between 1993 and 2013. More importantly, we need to remember that behind each and every one of these road crashes is the story of a family, of lost income, of pain, of broken dreams, and lost opportunities. And we know that the human error is inherent to our fragile existence. But we also know that other factors such as vehicle safety and the conditions of roads and how that plays into infrastructure is a very important role in making sure that those errors do not take our lives away. So we invite you during these 2 days to propose better ways to design effective and evidence-based solutions and interventions. For decades, our cities have been designed to prioritize vehicles. Today, there is a growing consensus on the need to rethink our cities for a more human scale to allow us to share our streets and prioritize pedestrians, public transport, and public spaces that facilitate the coexistence of citizens. Improving road safety and reaching the Vision Zero goal of not accepting deaths on the road requires strong institutions, minimum safety standards, and working jointly on safe systems. We at the IDB are helping countries to implement this new vision while improving transport infrastructure and road safety policies. Fortunately, we do not lack allies in this cause towards this Vision Zero. I want to take this opportunity to thank the collaboration of the International Road Assessment Program, the World Resources Institute, the Pan American Health Organization, and the World Health Organization, as well as Latin NCAP, Bloomberg Philanthropies, the International Automobile Federation, the FIA Foundation, the UN Economic Commission for Europe, and the United States Economic Commission for Latin America. These country representatives participating virtually, as well as my dear friend Jean Todt, the UN Secretary General's envoy, special envoy for road safety. So in sum, making cities and roads safe is our shared purpose. Working together, we are much more likely to have an impact. And therefore, I want to applaud your commitment, and I wish you all a very productive workshop. Thank you very much.
Thank you very much, Mr. President. We're going to have an address by Mr. John Todt, the UN Special, United Nations General Secretary, Special Envoy for Road Safety, and FIA President. He couldn't be here in person, but he sent us a short video. Thank you.
Dear Luis Alberto, dear Rob, dear Andrew, dear friends, I'm pleased to join you virtually today for the Vision Zero and Innovation Workshop. I'd like to thank the International Road Assessment Program, IDB, and World Resources Institute for organizing this event to showcase leading innovation in technology, financing, design, policy, and investment to save lives on the roads. In my capacity as UN Secretary General Special Envoy for Road Safety, I've been working with national governments, international institutions, private sectors, and NGOs to make road safety a global priority. Development banks around the world can play a leadership role in ensuring all infrastructure projects financed by them are 3 stars or better for all road users, not only vehicles. Smart and safe cities are also a priority as we strive to achieve Vision Zero target across the world. I'm pleased to share progress on the United Nations Road Safety Trust Fund that will provide catalytic support for action globally. The fund will support countries to build capacity and institutional strength to address the proven safe system interventions. Together with the FIA, UN agencies, organizations like IRAP, WRI, and the IDB, the UN Fund will leverage national investment that will leave a lasting legacy of safe cities, safe roads, and shared streets. With the energy of all of us, many lives will be saved. I hope I see you soon. In the meantime, I wish you a great and productive conference. Thank you.
Now we're going to give the word to Dr. Aslem Hennis, Director of the Department of Non-Communicable Diseases and Mental Health from the Pan American Health Organization.
Good morning all. Mr. Luis Alberto Moreno, President of the IDB, Madam Chair, distinguished delegates, ladies and gentlemen. It is indeed a pleasure for me to participate in this meeting of leading agencies, organizations, and partners from around the world to discuss how we can collectively reach Vision Zero, where no one is killed or injured from road traffic injuries. At the Pan American Health Organization, Regional Office of the World Health Organization, we are leading efforts with the health sector in our member states to ensure that effective policies are in place for road safety and intersectoral collaboration with transportation, the police, civil society, and others. Our work began as part of the global effort with the 2004 World Report on Road Traffic Injury Prevention and the creation of the United Nations Road Safety Commission. As you know, this is an informal coordination mechanism with about 80 members, including governments, civil society organizations, and private companies, all committed to implement the recommendations of the World Report. The UN Commission has coordinated numerous events such as United Nations Road Safety Week, several ministerial conferences, and the launch of the UN Decade of Action. It is thanks to these efforts, to which many of you have contributed, that a road safety target was established as part of the Sustainable Development Goals. The SDGs are driving government action and donor support with an ambitious agenda to reduce road traffic deaths by 50% by 2020 and ensure safe, affordable, accessible, and sustainable transport systems for all by 2030. This road safety agenda is juxtaposed by the reality that road traffic crashes continue to wreak havoc, are increasing among motorcycle users, and are especially affecting young men under age 29 years of age. In the Americas region alone, road traffic injuries kill more than 150,000 people each year. That's right, 150,000 people each year, adversely affecting their families and communities, as been pointed out by Senor Moreno. Every one of these imminently preventable deaths is a tragedy. And perhaps more tragic is the fact that youth are most affected, as road traffic deaths are the second leading cause of deaths in this age group. In addition, it's important to highlight that traffic crashes are one of the leading causes of permanent disabilities among all ages. We know that there are multiple causes of road traffic injuries, and their prevention requires collaboration with multiple sectors of government, partnerships within industry, and support from civil society. I can think of few other public health issues that depend so strongly on multi-sectoral action and a whole-of-society approach. I'm therefore pleased to see such a diversity of interests and expertise represented here today. The road traffic death rate in the Americas is 16 per 100,000 population, slightly lower than the global rate. However, rates vary widely across countries, from a low in Canada of 6 per 100,000 population to a high in the Dominican Republic of 29 per 100,000. This calls attention to the urgent action needed, especially in low and middle income countries, where road traffic death rates are twice as high as those in higher developed countries. Pedestrians, cyclists, and motorcyclists, who are vulnerable road users, make up 45% of traffic deaths in the region. Deaths among motorcyclists increased from 15% in 2010 to 20% in 2013, which highlights the need to protect these road users. Not only are motorcycles very fragile vehicles, but there's poor enforcement of helmet legislation, along with a lack of regulation of drivers. Furthermore, populations in several countries are shifting from walking to using motorcycles. PAHO developed and implemented a road safety action plan within the framework of the United Nations Decade of Action for Road Safety. A recent review revealed that 32 of 35 countries in the Americas have implemented at least one of the measures to protect road traffic injuries. Key institutional and program frameworks have been established. National lead road traffic agencies are serving as coordinating entities with other sectors in 30 countries, and improvements have been made to legislation on driving under the influence of alcohol and the use of child restraint systems. There are now 27 countries with laws on the mandatory use of these restraint systems, but only 16 countries have established a recommended blood alcohol limit equal to or less than 0.05 grams per DL. There are now also 27 countries with a pre-hospital care system integrated into the health sector. More details about progress in the region will be presented in tomorrow afternoon's session on tracking road safety performance. At PAHO, we have summarized current information in a scorecard of national road safety laws and action plans, which highlights the countries requiring the most support, and these include Belize, Bolivia, the Dominican Republic, Ecuador, El Salvador, Guatemala, Haiti, Paraguay, and Peru in the region of the Americas. There's an urgent need for scaled-up interventions to reduce road traffic fatalities and injuries, as well as to embed a sustainable road safety planning culture in these countries. PAHO has listened to member states about their needs for technical support on road safety policy, having convened a discussion to learn more about their progress, achievements, challenges, and strategies. Countries have identified the need for better strategies to enforce existing legislation enforcement, assistance to reduce fragmentation and improve collaboration across sectors, especially for speed management, and also to improve data collection surveillance for improved monitoring and tracking of road safety. We at PAHO have also devoted substantial time to reflect on how to strategically respond to the needs of member states for technical support for road safety. This has led us to create a new advocacy initiative together with the IDB and the World Health Organization to train journalists and lead media representatives on reporting road safety issues from a determinants of health perspective. In addition, we are widely promoting the adoption of stronger road traffic policies using the WHO Save Lives Road Safety Technical Package. This tool summarizes evidence-based priority interventions as well as practical implementation strategies to improve road safety. We all know that one of the most effective interventions to improve road user behavior and decrease road traffic casualties is legislation. Countries need to tighten their laws dealing with road safety risk and protective factors, but this needs to be coupled with effective enforcement. In spite of the advances noted, it must be emphasized that we are not at all on track to accomplish the SDG target of halving the number of traffic-related deaths by 2020. We must, however, continue to scale up our collective efforts, and I wish to highlight the important roles that we each have to play. Governments have to implement laws and regulations, establish infrastructure and oversight agencies to ensure enforcement to protect citizens, and ensure accessible and sustainable transport systems for all. PAHO WHO has the responsibility to establish standards and norms, promote health, convene the various actors to share experiences and best practices, measure progress and report on the achievement of targets, and work closely with governments to ensure advances. Civil society has responsibility to advocate and to ensure that citizens' needs and expectations are prioritized and met. The challenge of road safety requires multi-sectoral coordination, and this is where we all have a role to play. The international agencies, the multilateral development banks, the networks and partnerships, such as IDB, International Road Assessment Program, and the World Resources Institute, all here today. We have to strengthen our partnerships and to work collaboratively to advance the goals that we have set and to ensure that we meet the ambitious road safety targets, especially at country level. Considering the significant increase in injuries and deaths in motorcycle crashes in our region, it is recommended that policies aimed at motorcyclists are prioritized as we converge in our efforts to improve road safety policies. We also need to consider rapidly emerging risks, such as distracted driving due to the use of mobile devices and driving under the influence of psychoactive substances. I wish to thank the organizers for convening this intersectoral event and for stimulating discussions, new ideas, energy, and momentum so that we can all reach Vision 0. Thank you very much for your attention.
We will have to excuse President Moreno, who has a board meeting now. Thank you so much. And in order to continue with our program, we'll have now Rob McInerney. I'm sorry, I did my best. It's very difficult. Their CEO from IRAP, who will address us some words.
Excellent. So I'm sometimes known as Rob McInerney, sometimes Rob Machinery. I was most recently Mr. McNeil in Thailand, and and I've been Mark Nerney as well, so basically I'll respond to anything. But obviously I'd like to thank IDB and our partners at the World Resources Institute as well for bringing everyone here together. I think this is the event where we bring the best of the best, as I mentioned last night. And so all of us need to have our minds open to inspiration and to be walking away and to do something different than we've ever done before. And I'd just like to start with, like, what does Vision Zero mean for all of us? I'd like you to meet my two kids, Mia and Callan. I see them occasionally. They can pronounce my name now, which is good. But could you, like, if you stop and think, if I ever got that phone call to say your son or your daughter has just been killed in a road crash, I don't know how I would ever recover from getting a call to these kids that you invest so much in and love so much, to get that call one day and say they've just been killed or they've just been injured, they're in hospital, whatever it might be. I think every one of us in this room ultimately knows somebody who's been killed or injured in a road crash. And when you just think about that, there is no other option but Vision Zero. Like, how many people in your family would you be willing to have killed or injured in a road crash? And the answer's got to be zero for all of us. So it's got to be zero for your city, it's got to be zero for your country, it's got to be zero for the world, ultimately. And that's what this event is all about. And if we start to say zero is what matters, then really our starting point should be every road should be 5-star for all road users. Why not? Why not? And then we should have to justify why it's not 5-star and work our way back. Other than where it is at the moment, which is we're building brand new 1- and 2-star roads and trying to justify how it should be 3 and only have this much level of death and injury. We need to sort of start with why not Vision Zero and why not 5-star roads? Because I think the bit that makes me sort of look forwards as we hear the statistics of the past is to have a look at what does vision status quo look like? If we keep doing things the way we are, what is going to happen between now and 2030? 3,500 people dying every day. That means 15 million people will lose their lives. 15 million families will get that phone call saying, your son, your daughter, your mother, your father has just been killed in a road crash. 15 million people between now and 2030 if we keep business as usual. 500 million people will be injured, and they will be injuries like amputations, quadriplegia, brain injury, degloving. It's the skin being ripped from your body if you're a motorcyclist, as you talked about the motorcycle challenge. This is a scale that is so huge and the cost is massive as well, $24 trillion US. It doesn't have to be that way. With that bigger cost, we have to first ask, surely we're not responding on the scale that matters and also the scale that's economically viable. We can do a lot more than that. So when I look at the Vision Zero leadership, like, what is it? We all do make mistakes. I'm sometimes a 1-star driver, sometimes a 5-star driver. Sometimes a 1-star pedestrian, sometimes a 5-star pedestrian. We need the legislation and enforcement to get road users right, but at its core, our roads and the road system and the space where we all operate is filled full of 1, 2, 3, 4 and 5-star users. So we need to make sure that whether it's a motorcycle or a vehicle or a bus, that we're 5-star. Make sure we're hitting that 5-star vehicles right across the board. The Latin NCAP program that IDB is supporting, fantastic initiative. And likewise, why not 5-star roads? That should be our showcase. And then, importantly, bring that together with the safe speeds that will ultimately deliver Vision Zero. The star ratings of roads are intrinsically linked to speed. Even a badly designed road but travelling at 30 kilometres an hour can still be 4 or 5-star for pedestrians and cyclists. So it's just about us trading off mobility versus the infrastructure spend we're happy to put out there but don't tolerate death is the ultimate in terms of Vision Zero outcomes. And what we know from our star ratings of roads around the world and many of the evaluation studies that some of you have done in this room is that if we can go from that 1 star to 2 star, we will halve the level of death and injury. If we can go to 3 star, we'll more than halve it again, and halve to 4 and halve to 5. We can see this massive decrease in death and injury on our roads and the costs that go with road trauma. And the United Nations has actually embraced that by saying by 2030, all new roads must be built to at least a 3-star rating or better. Sadly, we're still building brand new 1 and 2 star roads. And as the UN Special Envoy said, John Todd, we should be building at the very least 3-star or better for all new roads. How could we justify building a brand new 1-star road and say that we're helping? We'd have to be leaving a tragedy following behind that investment as pedestrians are crossing their 1-star road. And we just can't do that anymore. So 3-star or better is the UN minimum. But Vision Zero is ultimately 5-star. And again, why not? Why not? And so I think the important part to think about when we look at that is it doesn't have to all happen today or tomorrow. We can start here looking at Washington as an example. Why don't we make it 5-star for pedestrians who are walking from Union Station down to the Capitol building? Fantastic, great, 5-star for pedestrians there. Over at George Washington University, 5-star for pedestrians and cyclists. That whole precinct right around there making that 5-star. Around the metro stops, 5-star for everyone. For the pedestrians, why not? Let's do that. Even Donald Trump's getting in on the picture. He's got a little sign up there saying, "Make America 5-star again." Sorry, I meant to have my hand like that. Thanks, Donald, that's great. We'll go 5-star for pedestrians around the White House. Along the major thoroughfares, 5-star for pedestrians, 5-star for cyclists, 5-star for motorcyclists, 5-star for vehicle occupants. On every one of those big major roads. Let's do that. And for the Mall, one of the great tourist areas, 5-star for pedestrians, 5-star for cyclists, that entire area. And then suddenly, if we're doing that on a scale that matters, road by road, precinct by precinct, university by university, we will end up creating this environment that suddenly we're painting the city green. It's 5-star. And we end up with entire 5-star communities, one road at a time. But we can get there. And it's all by having that vision. But what we're hoping is this will create competition. If I'm doing a transit-orientated development at a metro station, why not make it 5-star and make that part of the differentiation and competitive business? It makes good business to keep people alive. And so creating these 5-star cities, 5-star rural areas, 5-star communities, 5-star countries, and we bring that together and suddenly Vision Zero becomes a reality. And from there, everything is possible. From there, it's Vision Zero US, Vision Zero Belize, Vision Zero Brazil, Vision Zero Colombia. Suddenly the entire world will be Vision Zero. And that matters because every life counts. Thank you. Muchas gracias.
Thank you very much, Rob. Now I will give the word to Claudia Adriasola, who is our Road Safety and Health Program Director for WRI.
Good morning, everyone, and thank you very much for our hosts, Marisela, Ana Maria, Nestor. Thank you so much for having us. Thank you to IRAP for the work together, and to all of you for joining us today to talk about Vision Zero and to really understand what that means and how we can advance this agenda in the Latin American region. So Vision Zero is something that 3 or 4 years ago has come as a big branding. It's like ABBA has come back again from Sweden, and we are all singing it, but we have to understand what really is Vision Zero, because we see it replicated everywhere. But the principles of this very important branding for safe systems is what really is going to make us, as Rob was saying, to see if we are eliminating fatalities and serious injuries from our roads. So that's where we have to put our thinking, because Vision Zero is really a big paradigm shift. It's a completely new way to see road safety. And that's where the energy needs to go, and where we all need to work together to see what are the best strategies, and where is where we are finding this point of resistance, and work really jointly. When we talk about Vision Zero, and we've been working in Latin America, in Africa, and in Asia, we find people that are very skeptical about getting to zero. I mean, there are so many people that are dying and getting seriously injured. We take it for granted that we build roads, we have cars, and we have motorcycles, and with that comes a number of fatalities, and we have come to accept that. To accept, as Rob was saying, and I think we all were very moved at that moment, that children die. As a matter of fact, in our countries, this is the first cause of death for kids 5-19. It's a horror what we are experiencing, and yet we have come to accept that. To look at other forms of transportation, air transport hasn't accepted that at all. As a matter of fact, last year they had 0 fatalities in commercial airlines. They have achieved that, and if you have been following the latest traffic crash in Indonesia, it has made first page in the New York Times, in the Washington Post, and in every single main media outlet. And why? Because they really go deep into what happened at that moment and how we can overcome. They will not just go and blame the pilot or blame some of the people that were in charge of maintenance or the people that produced the airplane. They will look at that holistically as a complex issue. So we have been studying the topic because, as you all, we are very interested in making this happen in the world, and in this case, in Latin America. We have produced a guide that is called Safe and Sustainable. It's a guide to build your plans on Vision Zero and safe systems. And in this guide, one of the things that we have looked at is at 53 countries and how they have been performing in road safety. What we have found is that countries that have adopted safe systems, that have adopted a type of Vision Zero plan, have reduced the number of fatalities immensely compared to the countries that haven't adopted that. And just to put it plain and clear, they are still blaming the victim for the traffic crashes. So we calculated that if all countries will adopt Vision Zero and start working on that direction, we will be able to save 1 million lives. Right now, we are losing around 1.3 million lives. So there is still a very important way to go in terms of making our systems safer. In terms of low and middle-income countries, this is a must. And we have an amazing opportunity here because we can leapfrog 20 years of a lot of experience, a lot of tests, a lot of things that haven't worked. And we have a representative here with us, Mats Åke from Sweden, that can testify, as well as Veronica, that has been working with road safety and Vision Zero in New York, that there are certain things that don't work. And we have to go back and change them, right? So that is a perfect moment for our countries to look at what has worked and how we really leapfrog and make changes quickly. The opportunity also, and speaking on behalf of the World Resources Institute, an organization that focuses on environmental issues and in particular climate change, comes as a piece that can be linked together to these other societal benefits that cities and countries are looking for. As I said, climate change, but other worries that we have as air quality or physical inactivity that is killing a whole lot of people, and equity and poverty are things that can be absolutely linked in this work on road safety. We are seeing already changes. We have seen Mexico City and Bogota, big cities in our region, coming up with their plans and seeing already results. 2 weeks ago, the city of Bogota announced that they will reduce the speed in 5 arterial roads to 50 kilometers per hour. That will be the limit. And in these 5 arterial roads, 25% of the fatalities in Bogota is less than 600 fatalities occur in these roads. So we are already seeing, if you compare what was happening in October or November of last year in Bogota to this year, the reduction is substantial. We are seeing also cities in Brazil, Sao Paulo and Fortaleza, focusing on Vision Zero and working hard on that. So it's really interesting to see the development in our countries, give us a lot of hope, but also give us a lot of concern to get it right and not to just have another branding on road safety. So let's go back, and we are talking about Vision Zero, but what is the substance of Vision Zero? Where is the change? And really the change is very interesting because it brings us back to our human nature. For many years, and that's what happened in Sweden and in Europe before we started working on safe systems, we were trying very hard to just work with the road users or work with the drivers, right? And just try to manage and change their behavior as much as possible without focusing much on what is the nature of us, right? So we are prone to make mistakes. Humans make mistakes constantly, and it just takes one single mistake. One day that we are driving late, or that we are tired, or we just have to rush through that yellow light to pass, and a biker is coming on the other side, or a scooter now. And that takes away the life of a person or her or his health forever. So that's something that seems so, self-explanatory. Of course, we make errors, but we haven't been taking them into account into our transport system. And that's something that needs to be there. We need to plan cities, we need to plan roads, we need to build our vehicles thinking that one day we will make a mistake, and that should not take our life away. Second, that we are very vulnerable to injury. Our human bodies haven't been exposed to a speed for generations and generations. We have invented the car 100 years plus, and that's what we started experiencing speed. So look, I have asked a couple of colleagues there, Rafaela and Ben, to just jump to the first floor to demonstrate what will happen once they are on the floor. And that will be comparable to them being hit at 30 kilometers per hour. So Ben and Rafaela, please. No. Well, I don't have any more volunteers. But imagine, that's only 30 kilometers per hour, less than 20 miles per hour. And none of us will be willing to jump, because we know that we will be injured, we will fall in a wrong way, and probably we will even die. As a matter of fact, 10% of people that are hit at just that low speed die. And when it goes a little bit higher to 50 kilometers per hour, That's like jumping from the 6th floor of a building. The chances of survival for a human being are only 20%. So we are very vulnerable. Our bodies can withstand kinetic energy, speed. The responsibility is shared. For a long time, we have seen efforts, endless efforts, to just focus on children and to educate them to try to deal with the traffic system as it is. But that needs to change because we already know that speeds, high speeds, are very hard for adults, and for children, the more, right? They don't have the same vision, the same restraint, they don't calculate well the risk, even worse than the calculations that we do. Their vision is not really focused, so we need to balance that responsibility, but educating by helping our planners, our engineers, our legislators to understand that the balance needs to be even. So that responsibility needs to be shared, in particular with the ones that have the possibility of allocating resources. Being proactive and not reactive, we know already where the traffic crashes are happening, and we don't need to wait until we know again that some person has died or got seriously injured. And finally, no death or serious injury, and in that we all agree, should be allowed. We can accept that. That has a big economic impact as well. A research done in Korea a few years ago shown that people that got injured and were able to go back to work, their salary was reduced in 60%. And that is substantial if we are thinking about economic development in our cities. All right. So I'm running out of time, but my main message here is when we are working on Vision Zero and safe systems, let's make sure we are really going into what is going to make the changes. And one of the main topics, as Rob has already mentioned it, is speed. And we are going to find a very big resistance because unfortunately it's mistaken with congestion in cities. And that is not the case. We will have conversations through the day today and tomorrow to understand how we can reflect on that topic. I thank you very much for your attention. I thank you in particular for being part of the road safety community that we need so much. Thank you very much.
Thank you, Claudia. We'll have our last panelist. So I welcome Veronica Waterpool, the director for Vision Zero Network.
Buenos dias. Thank you to IDB and IRAP and WRI, and thank you, all of you, for your collective efforts to save lives and to reduce traffic fatalities. I am with the Vision Zero Network. We are based in the US. I am actually based in New York. And while Vision Zero is fairly new to the United States, in fact, the first Vision Zero commitment was made in New York in 2014, innovation is happening. Innovation is occurring. We are accustomed to thinking of innovation in terms of technology or product development, but innovation is as important in our thinking as it is to our tangible, practical products. We are seeing innovation in the United States, and what I want to talk a little bit about is how we're using data, how we're seeing innovation in advocacy and language, how we're seeing it in engineering and road design, and how we're foremost seeing it in our shift, this transformative shift that many of my co-presenters have talked about, this shift to a safe systems approach. And why is that shift important? Because we in the United States, and certainly around the world, are accustomed to equating mobility and freedom with a car. With a car, you have access to beautiful homes. With a car, you are relaxed and excited and free. With a car, you can access remote and lovely, beautiful places. We have equated our freedom and our mobility disproportionately with the car, particularly in the United States. And as a result of that over-reliance in messaging, that over-reliance on the personal vehicle, we are seeing a tremendous calamity in our communities and on our roadways. These are pictures from International World Day of Remembrance. Many of you may have participated in honoring those who have been impacted by road crashes around the world. It's the third Sunday of November. And these are pictures from various events in the US. And what we are seeing harnessed in these pictures is pain. And underneath that pain, we are seeing anger and we're seeing frustration. We hear a lot of data, a lot of numbers. 1.3 million people around the world are killed. In the US, that's 100 people a day. 40,000 in the US every single year. These are the streets that we put our children on. These are the streets that we encourage them to take to walk to school, to walk to after-school activities, to visit friends and family. This is a product of this thinking, this shift that we have to move beyond, this shift in thinking that car is the only mode of mobility, is the preferred mode of mobility. Now, I want to be clear that having vehicles for many is a necessity. It is a product of our community design, of the way that we have disproportionately put our funding, our attention, and our policies in favor. And vehicles do provide us with a good deal of flexibility and a good deal of access to housing and economic opportunity. My point is our over-reliance on that as the mobility mode for freedom, where there are other modes of mobility that afford us that freedom, that are safer, that are greener, that are healthier. I mentioned 40,000 deaths in the US every single year. That is more than double the number of victims of annual gun violence in the United States. It is the equivalent of people who die in the United States every single year for secondhand smoke. Yet, we do not approach traffic fatalities with the same level of urgency and attention as we do for secondhand smoke and gun violence. All important issues. The horrors of gun violence, especially in the United States, have generated a good deal of activism, concern, and legislation. But we are not attributing that same level of crises to road traffic fatalities. In fact, we're not seeing at the local level a lot of the initiative. We're not seeing, with regards to secondhand smoke, for example, many local communities are banning smoking in public parks because of that exposure. We're not seeing that translated yet into traffic fatalities. Since 1975, more than 1.8 million people have died by being hit by a vehicle in the United States. And that doesn't even include the numbers through 2018. That is more than the population of San Diego, California. That is more than the population of Philadelphia, Pennsylvania, or San Antonio, Texas. The previous slide said we should be outraged. People are outraged. What we are seeing is people coming together, showing their stories, showing their pain, harnessing their energy into activism. We are mobilizing, organizing, advocating, legislating, re-engineering, rethinking. We are innovating in our thinking. Innovate is to introduce a new idea, a new method. Vision Zero is that. We are moving from vision to action. So as I continue to talk about this, I just want to point out the ways that we're seeing this. We're shifting to safe systems, advocacy, language, innovation in street design, data. It is way beyond the time. We are overdue for a new approach. Sweden implemented Vision Zero in 1997, the first US city, New York, 2014. In that time difference, 702,000 people died in the United States in traffic crashes due to that potential lag. Perhaps if we had adopted Vision Zero a lot sooner, we may not have seen 702,000 deaths. The shift that we're talking about is a safe systems shift. It's a transformative shift in the way that we think. From thinking that traffic deaths are inevitable to knowing that traffic deaths are preventable. To thinking that we can build a system that perfects human behavior when we know that we cannot. To thinking that the responsibility for safety rests with the individual, when in fact the responsibility for safety has to be integrated into all of our systems. Safety for all, safety for everyone on our roads. Key to that is managing speeds. And in the US, speed is a factor in 27% of our traffic fatalities. Yet cities in the United States do not have the authority to manage their own speed. Most cities need state approval in order to do that. New York was successful, Boston was successful. There are 19,354 incorporated places in the United States. We do not have the time to do this one by one. 100 people a day are dying. So we've heard that we need to think about this as a public health crisis. In fact, in the United States, part of our challenge is thinking that this is a transportation problem. It is not. It is a public health crisis. It is a problem that intersects all different sectors. So this spectrum of prevention is really about finally getting to legislation and networks and coalitions. We spend a good deal of time in the blues and the purples educating, but we cannot educate ourselves and the public to reducing fatalities to zero. So the Vision Zero Network is a facilitator of peer exchange, of communication. We provide resources. Since 2014, we have 30 cities, more than 30 cities, committed to Vision Zero. And what we do is we bring them together, we provide resources, we provide an opportunity for cities across this country to share resources, information, practices, best practices, data with each other. And we do this by convening these cities together and producing a lot of resources that we share along with the resources you all produce. Yep. Advocacy. That is critical to Vision Zero success in the United States. This is Families for Safe Streets, a coalition of those who have been impacted by traffic violence, started in New York City, now more than 9 chapters across the country. They have been the most pivotal in getting change, legislative change, particularly in New York, reducing speed limits in New York City. Language. In the United States, we need to change our language. It's not an accident. These are crashes. And the importance of this is reminding people that these are preventable. We have the tools to make these traffic fatalities down to zero. Road to Zero, this is a national effort now. The significance of this is most of the activism and advocacy has come from the local level, the state level. This effort, this national effort started in 2016, is the first time that the federal government has acknowledged that 0 is the right number. Cities are using data and showing the disproportionate impact. Data is key to Vision Zero implementation in the United States. How it's impacting certain communities, low-income communities, communities of color, those who are mobility impaired, those who are young, those who are seniors. Los Angeles and San Francisco are mapping where crashes are happening in particular, and using this to concentrate their investments. And what we're seeing here is that the impacts of our car culture do not impact all of us equitably. There are certain constituencies and demographic groups that are most impacted by this culture that we have. So I just want to spend the last few slides just showing some innovation in street design. We are nearly approaching a decade in New York City of the transformation of Times Square. 121,000 square feet of public space was added. Traffic fatalities are down traffic crashes are down 15%, pedestrian fatalities are down 40% since this change was implemented. Austin, Texas. This is a city where 94% of households have access to a car, where the average number of cars is 1.6 per household. They are changing their thinking. They're re-engineering their thinking and their roads. Fremont, California. Very simple improvement. 2-lane road, narrowed to include a bike lane. Paint. Re-engineering, rethinking. Philadelphia, thinking about green stormwater infrastructure as they think about providing safer roadways. Bioswale is in the center of this. Boston, Massachusetts, thinking of how to align transit with Vision Zero. There was a new analysis that showed that cities that invest in public transit can reduce fatalities from vehicles 10 to 40%. So Boston is integrating these changes and improvements. As is San Francisco. You're seeing a coordinated, holistic approach to thinking about all the mobility modes and giving increased priority to those who are walking, taking transit, and using bicycles. And lastly, I want to end with this slide. This is a picture from the Road to Zero Coalition. And I wanted to end here because it captures so much. We see how we fit our humanity, our society, our people into little pockets of our roadway infrastructure. That is not how we want to live. That is not how we should live. We should be looking at pictures of vibrant cities, of people who are walking and biking and enjoying each other in public plazas and public spaces. And that is not what we see in the United States. This is characteristic of the road infrastructure that has indeed provided us with a good deal of access and flexibility. But I think our takeaway is, how do we provide better balance? How do we put people at the center of our transportation, public health, mobility systems more broadly? Thank you.
Thank you. Thank you. Thank you, Veronica. Now we're going to join to a quick discussion between all our panelists and looking we have a couple of questions that were shared with us ahead, and I would like to open them for all of you in order for you to share us your perspectives on this. And the first question would be, what are the priorities in the next 2 years to move towards Vision Zero goal? What had been missing or could have been improved if we started again back to 2010? So if we started the Decade of Action again, what should have been done differently, or what has been missing, or what could we've done better? And the last question, what would be your most important lesson learned over the time, over all the successes and failures, you as a person, but as a professional within your organizations, that you would like to share with the audience? Before your answers, I would like to thank again to everybody that it's online. We've been seeing a couple of questions and participation, so thank you for following up. We'll try to share as much as we can through your questions. So thanks, and keep tuned. Please. Whoever wants to start, yeah?
Should I start? Okay, can you all hear me?
Yes.
Great. So several questions and really interesting ones. I think if we think, what can we do right away to start seeing a decrease in the number of fatalities? I think the aim is to reduce the speed in cities, in urban areas, to 50 kilometers per hour, as the World Health Organization has recommended. That definitely is a must. It's something that is not that easy to happen. We have seen a tremendous advance, for example, in Mexico City. They put a lot of safety speed cameras, and we have learned that the incoming mayor might change that to go back to other methods, which just shows how difficult it is to take this measurement. And I think as a community, it's something we need to do very quickly. A few other things: setting targets, for example, in each of our places. Yes, we are trying to achieve Vision Zero, but that is a vision, and that what does is help us to reject fatalities and serious injuries, but then we have to work on a target that is achievable. And some places will have lower targets and others will have a higher target, but it's important to follow through and try to really see what are the changes. I think we are in the right path. 10 years ago, we started working to be really fair with the work on road safety. It was starting 10 years ago, and it has taken a little bit of time to build capacity, to have the topic disseminated. WHO has done a great job on steering us and moving us all forward, gathering us as much as we can, and now we see that there is a lot of leadership. So I don't see the decade as a failure. I think it was a very important building block, and we can move forward to that now with decisions that are really hard. As I said, lowering the speeds, start working together because it's a complex issue. And what we are experiencing in the cities where we are working is that the Secretary of Mobility doesn't necessarily have the power of changing the roads. That's under the Development Secretariat, right? And these two sometimes don't talk to each other. So how do we make them talk and have a goal that they are both accountable for? So joining that. And just to answer quickly what has been challenging, what we consider a success, I think in particular for the World Resources Institute, it has been the focus on cities. 10 years ago, when we started working in road safety, the focus on cities was not as great, and we were working on mobility at that time. So we started looking at the data and realizing how crucial was to have sustainable mobility, as you were saying, Veronica, to reduce traffic fatalities substantially. We look at the example of Bogota, and once they implemented Transmilenio and many other measures to protect pedestrians and start building infrastructure for cyclists, the reduction of fatalities was 50%. They used to have 1,200 fatalities. Now they are half that. They are around 540 fatalities and going down. And after that, to really focus on who gets the worst burden of it, and are the pedestrians, the poorest, the ones that really don't have a vehicle to be protected, right? And the ones that are really trying to break the status quo and using a bike. Our young people, they are the ones that are dying, and they are the ones that, if you think about sustainability, walking and biking are the most sustainable ways of transportation. And we ought to make a space for them and to protect them. So that has been, I think, something that we see positively. Challenging has been really to get to the nitty-gritty of Vision Zero and not just stick to a brand name, right? And really push hard for speed, which again, I'm sorry to repeat it so many times, is one of the hottest topics where we all have to really put our brains together and help cities and help endly politicians, right? Because the communities wrongly see that speed is the problem. Speed is not the problem. It's the way how they are moving in the cities. And if they put many vehicles that have just one person traveling in that vehicle, that's where the problem is. It's not in the speed. The speed in cities like New York City, Bogota, Sao Paulo, is not more than 20 kilometers per hour, sometimes even less than that in average. So I hope that answers the question.
Thank you, Claudia. Dr. Hennis, please.
Yes, thank you. Thanks very much for those comments. I think one has to recognize that road crashes are a public health crisis, a global public health crisis. Well, the reality is that the factors that lead to road crashes are beyond the health system, but the ultimate impact is on health in terms of mortality and disability. And I had a very interesting conversation this morning with Rob about the things we don't measure. We measure mortality. It's very easy to measure people dying, but we are not very good at measuring the long-term impact of disability. most people who are affected are actually young people. So if you're looking at a lifetime of being unable to contribute to an economy, a lifetime where people have to provide care for you, these are the unmeasurables. These are the indirect impacts of that crash. So there's much more information that we have to acquire over time. Now, the issue of the fact that road crashes occur beyond health relies on multi-sectoral engagement. No group can do it, can manage road crashes by themselves. This requires government, civil society, other partners, as you said before. And ultimately, working collaboratively is the way to make that change. We need to have issues in terms of mass transit, as discussed before. We have to look at issues in terms of enforcing drink driving laws and the new challenges that we're facing, for example, with the legalization, decriminalization of psychoactive substances. We're looking at new crises that are going to evolve, that are going to face us. Issues of vulnerable populations. Those populations in countries in the Latin American region particularly, which has seen an increase in available resources, income. And so they're moving now from walking to motorcycles. But there's no regulation of motorcycles. There's no enforcement of helmets. So you now are seeing trends in terms of new crises that are evolving very quietly that we're not yet conscious of. And this requires the whole need of legislation as well as enforcement. The laws are on the books in terms of drink driving, but they're not enforced. Many countries do not have access to breathalyzers. And unless you put these systems in place, the mortality will not change in ways that already exist in terms of the laws. We need more information, and also, as I said before, we need to work multi-sectorally and collaboratively. But if we follow through and really integrate our efforts, we can see the difference. There's evidence that big differences can occur with collaboration, multi-sectoral engagement. And I think that has to be where we take this discussion forward.
Thank you very much, Robert.
Excellent. Priorities for the next 2 years. Clearly, we just cannot let any brand new 1- and 2-star roads be built. When I look around the world in every region, in Latin America, in Africa, right through Asia and Europe, we're still building brand new 1-star roads. And I'll give you an example. We went to one of the countries where there's this brand new 4-star road being rolled out, and it's this sort of cross-sectional approach to road design that we have everywhere in the world. And this 4-lane road just rolls straight through the village. No change in its design, it's just this freeway built through a pedestrian mall. And it's going to kill and injure pedestrians and cyclists and those people living in that village for the next 20 years, next 30 years. To have built it safe would have added maybe 1 or 2% to the cost of that project. All the big costs are in the pavement and everything else, and so a very small additional cost would have actually lifted the burden of death and injury off of that road for the next 20 years. And like when we look at the fast developing regions, they're investing large in infrastructure, whether it be urban or rural or connectivity to remote communities that are getting access for the first time. Don't burden them with another 20 years of injury is what I'd say. So making sure in the short term that every one of these roads absolutely 3-star or better, and quite possibly make them justify why not 5-star. Start there and work your way back to how much death you're willing to have, rather than trying to justify that I'll save 10%. So I think with the big new investment by IDB, by others, like making sure there's a pass mark for road safety immediately is really important. If I go back to the Decade of Action question, I think Dr. Hennis, that discussion we had this morning was great, because if you go back to the World Health Organization website when we had the first 5 pillars come up, Pillar 5 had a little video of highlighting one of the post-crash care related treatments, which was to put in a emergency trauma ward every 15 kilometres alongside a major highway in India, I think. And you look at it and you just go, my goodness, like our perspective on the world was quite wrong. And what we have missed all along from the start of the decade is that true scale of the health burden of the individual dealing with an injury for their entire life, the costs that come in right the way through that system. Because what the big problem with road safety is, all of the costs and benefits are in one bucket, but all of the solutions are in others. And so this group's over there beavering away with the best they can do with the resources they've got and justifying a level of death as a result, while over here they're trying to optimise care and treatments of people already injured and lifetime injuries of quadriplegia, brain injury, those ones that we talked about. So we're doing some work now with the monopoly insurer in Australia, which I'll talk about tomorrow, which is to try and make that very visible. Because I think when we understand the true depth of not just the death, but the serious injury burden on economies, on communities, but more importantly on families, then we will start to invest at a level that matters, at a scale that matters, and a scale that will make a difference. So if we didn't have that at the start of the decade, let's make sure we've surely got Vision Zero targets, 5-star road targets, and an understanding of the true cost of road crashes for the start of the next decade.
Thank you. Veronica, please.
In the US, we don't yet have the longevity of Vision Zero to fully do a complete assessment, but I am seeing some themes emerge. What I'm seeing is that this is being primarily addressed as a transportation problem. I noted that in my discussion. It is not. We all understand that. Vision Zero Network is helping to move this conversation beyond just the transportation sector. With regards to enforcement, as another theme I'm seeing, that is a problematic issue of the 3 E's in the United States, particularly because there are communities throughout the US that have seen increased levels of police enforcement tied to Vision Zero. And that has generated issues of concern with equity and justice. So that is not something that the Vision Zero movement in the United States can lead with. In fact, we all know that Vision Zero is not just about enforcement. It is actually so much more than that. So we are overcoming that hurdle, again, in our language, in our advocacy, in the innovative ways that we are pulling different stakeholders together. And then with regards to the number of people who have died in the US, so 1.8 million people since 1975. So there have obviously been a good deal of efforts and advocacies over that time. But what we see in the US is a good deal of distraction. And I don't know how other countries manage and handle this, but our latest distraction is that of distracted pedestrians and how we are seeing traffic fatalities increase because we have distracted pedestrians. And I bring up that point to say, again, we have a good deal of distraction from the real issues in the United States. So while we are still in our very nascent stage of Vision Zero, we do have a long record of fatalities, unfortunately, but advocacy on complete streets and livable streets, trans-oriented development, and now Vision Zero is part of our language and part of our overall toolkit. And we need to start thinking about these different themes of enforcement, of distraction, and how we need to tackle that and break beyond this transportation limitation.
Thank you. We have one last question from online. The people here, we're running out of time, so if you have a question, I would advise to do it through in the coffee break, so we're running out of time already. So there's a question coming from the Caribbean. So they're just mentioning, they heard a couple of the presenters talking about Latin America, but often the Caribbean feels a bit left out of the programs being developed. So just if any of you have some experience or some cases you would like to share of what's the situation in the Caribbean and what should be done, or how can we work together in order to also make a big change there, because they have been facing very important problems as well. And this is coming specifically from Jamaica and other countries from the Caribbean. So if any of you have, Claudia, please.
Yes, we've been working in the Dominican Republic. My colleague here, Anna Bray, has been leading our work there. And we have observed that one of the issues is the roads that are built there, right? So we have beautiful places, striking views, and places that can be used by all the public. But you have a big highway, basically, that is preventing you from getting there safely, right? So there are efforts to put, for example, bike lanes, but if they are not connected safely to the rest of the city, then it's really hard, right? So again, it boils down to asking the question, if we put a bike lane there and we make that big effort, but it's next to this highway that is bringing freight from the port to another side of the city, what will happen, right? And all our learnings about Vision Zero come into test right there, right? Are we gonna blame the biker because it's not careful enough to cross and deal with the trucks, or are we going to really build infrastructure that will enable them to travel around the city? So the Caribbean is a beautiful place that can be so much, bring so much joy for the people that live there. And we have to reflect on what is preventing these people to really be able to use the cities, to use the beautiful places that they have safely. So one is the design of the roads, prioritizing where pedestrians and bikers are, and making these places low-speed zones, thinking a little bit about the logistics, right? Maybe the logistics, we want to have them later at night and reserve the city in the mornings for our most vulnerable people. But thank you for the question to our friends in the Caribbean.
If Dr. Hennis and Rob later.
I'll say very briefly regarding the Speaking Caribbean, some of the challenges really have been issues like infrastructure, trying to emphasize the need for spaces for walking and for cycling. So I think these are philosophical issues that need to translate from philosophical into practical issues, whereby people have more access to the use of space for recreational purposes. Issues of enforcement are also a challenge. And I know we've been working very close with the road safety groups and experts in Jamaica. Issues of enforcement of drink driving laws and breathalyzer tests and so forth have often been a challenge. And to say a little bit more, there's sometimes concern in some of the islands about the impact on tourism and having people have access to local alcoholic beverages. And then a concern that if you enforce the breathalyzer tests, it might impact negatively. And I think these things have to be tackled head on. There's no way to do it. And also the issue in the Caribbean of having better mass transit facilities and capacities. But we do work closely with the Caribbean, including the Speaking Caribbean. But there's much to be done.
Thank you very much, Dr. Hennis. Before going to Rob, I would just like to add on what Dr. Hennis was sharing, that we are actually doing a joint effort between PAHO and IDB, a study on alcohol prevalence in injured people in the hospitals, in emergency rooms, in 4 countries of the region, and Jamaica is one of them. So that's one of the projects that we're working jointly, first to have the data in order to have, as it's being mentioned by all of our speakers, the importance on really work on target evidence-based interventions. And in order to do so, we need data. So just complementing what Hennis was saying, we are working on that data that we are lacking regarding alcohol and drugs. So other substances in injured people in emergency rooms in Jamaica. So hopefully we'll have that data soon to share with other countries and share with the rest of the region. So Rob, please.
Excellent, yeah. So in terms of Jamaica, some exciting work's happening right at the moment. We have our new Star Rating for Schools program that's being rolled out globally. And most recently in Jamaica, we've been working together with the Child Health Initiative, the FIA Foundation, UNICEF, FIA, and FedEx and the local partners there. And that's gone in and had a look at a school, and we've done the star rating of the existing school environment. And they've already done the upgrades with another fantastic NGO called Amend, who's been doing the actual upgrade work there. That's taken that school, I think, from sort of 2 and 3 star up to 4 and 5 star. And it's a great place to start, because the idea of, like, our kids our kids deserve a 5-star journey to school. And so that commitment's happened at one school, and there's already now commitments to roll that out to 17 schools, which is fantastic. And the Child Health Initiative has a fantastic video about that experience in Jamaica that I can make sure you can share to all the colleagues through the region.
Please.
From an IRAP perspective as well, we've had some fantastic partnership work with the Caribbean Development Bank. One example in particular in Belize, where from Belmopan to Belize City, they actually did a very safe system approach. So they did the IRAP assessments to bring the road up to 3-star or better for all road users. But they also then brought in the enforcement and the community education elements and teaching people about the new facilities that have been built. And they've seen, I think, whether Julio's here, the number I think is like a 60% reduction in death and injury on that road, while the deaths on the rest of the network in the country have gone up. So that sort of partnership in Belize, a very safe system partnership, has had great success. And we've also had our programs rolled out in the Cayman Islands, in Barbados and St. Lucia, about to begin as well. So this sort of getting an understanding of the safety of your road network, working out where the high-risk locations are, and from an infrastructure perspective, zooming in on all these high-risk locations and sort them out is all we need to do. And the partnerships with IDB and the countries to have a long-term partnership to bring your roads up to 3-star or better is a great way of having a win-win outcome for road safety and development.
Thank you very much. So before closing this session, I would just like to add as well, I think it's been clear that we have to work on a multisectoral manner in order to reach Vision Zero. One of the actors that was not clearly mentioned was, for example, the importance of media and journalists. As Claudia mentioned, right, like the outrage and all the exposure that gets other news when there's like a plane crash or other kind of fatality, a natural disaster, for example, it's just in the media all over. So it's very important for us also to work with the journalists around our communities to get them the message of why is it important to talk about road safety and how should they do it? How should they focus on the prevention part and how should they focus on what were the risk factors involved in that crash rather than the blood and all the pain behind it, really work on how could it be prevented. And on that, actually, that's another program we've been working with PAHO, having these journalist trainings across the region in sub-regional, and I make the link with the Caribbean because we've done 2 sub-regional trainings already, and the 3rd one to take place normally next the first trimester of 2019 will be in the Caribbean. So thank you very much. It's been a pleasure hosting this amazing panel. We're going to have a quick lunch break, and please come back at 11 to have our next workshop on safe cities. Sorry, coffee break. So I'm hungry, I'm sorry. So after coffee break, let's meet here at 11 to start our workshop on safe cities. Thank you very much. Thank you very much.
All right, thank you very much for coming back. And we are ready to start. This is the Safe Cities Interactive Workshop. And I would like to invite Ana Maria Pinto, who is a Senior Transport Specialist in the Inter-American Development Bank, to welcome us to this session. Please, Ana Maria.
Hi, good morning, everyone, and buenos días. I don't really want to take too much time off the panel because we have very, very interesting presentations coming. I just want to welcome you again to IDB, and for me, especially as the coordinator of the road safety strategy, it's an honor to have you here. And this particular session is very interesting for our region and comes to a very good moment because the urbanization rates are growing and growing in the world, but more in Latin America and the Caribbean. And road safety is becoming every day more an urban problem as well. So we've been like hoping for this workshop, and I take this moment to as well to thank and to welcome all the participants that are connecting via WebEx and the different channels, because we have as well representatives from the governments in the region that are policymakers implementing road safety strategies or actions. And something that we've all been talking about is how we can really pass from policies to evidence and to actions that really made a difference. And I think this is what we're doing, shifting the paradigm, shifting the approach, giving new tools for us to be more effective of what we're doing. And I think we all like have been like hoping for this. So I just want to reinforce that there is an urge to be more effective, that we in the bank have a strategy to help the governments in doing this through different tools, to different strategies. And we really want to team up with different organizations like we're doing now. So I want to thank IRAP and WRI and all the different organizations that are helping us and helping the governments in doing this. So Claudia, I really think that we just go to the discussion. I think President Moreno kind of gave, who better than him to give all the basically the importance that this subject has for the bank. He himself is been a champion in this project, and is always with us in all these important efforts. So I just want to make a call for all call for action in the governments, in the region, in all the organizations, and just reinforce that the bank is here to help to doing this project or doing these strategies as well. So I'm more here coming to learn for this the approach. We had a Swedish representative in a workshop that we have a month ago here about vehicle regulation. And we're very impressed of really, I know we've been to different presentations about the case of Sweden, but we're really impressed of how, when we go into detail, how they did it and how they inspiring us to make this change. So I don't want to take much time, and really looking forward to the presentations. Thank you, Claudia.
Ana Maria, and really big thanks to the Inter-American Development Bank for putting road safety at the center of the discussion in the bank and showing their interest and priority. So I would like to get started and to do just a recap on the approach on Vision Zero. I'm using this framework. That is the framework that we came up with in the recent publication that I mentioned in my previous, if we can go back to the slide, please. In my previous intervention. So Sustainable and Safe is a vision and guidance for zero road deaths, and we launched this publication earlier this year. Is getting ready in Spanish and in Portuguese, and pretty soon we are going to have it ready for the region as well. All right, but allow me to repeat a little bit, and I'm doing this because we have more people that have joined online, and I just want to make sure everybody is on the same page. So when we talk about Vision Zero, we have tried to look at what are the principles and what are these core elements that beyond the principles will make actually these ideas to be implemented, and then what are the action areas where we focus, where we ask cities to focus. In terms of the principles, humans make errors. We're going back and forward to the slide. We just need to leave the slide there. Thank you. Humans make errors, and this, as we discussed, seems to be self-explanatory, but we haven't been deciding our road systems in that way, and we have to allocate a space for human errors. In terms of the vulnerability of our bodies, we are very vulnerable to injury. Being hit at 30 kilometers per hour still has 10% chances to being killed, and if that goes only to 50 kilometers per hour, our chances to get killed go up to 80%. So very important to realize that we cannot expose ourselves if we are going to be prone to make mistakes to have high speeds, because that is where we can get easily killed or seriously injured. The responsibility is shared. For many years, we have tried to put the responsibility only in the users of the system, being pedestrians, cyclists, or drivers. But who designs the system, who designs the road network, who designs the way we move, if it is public transportation based or if it is more private car based, if we add walking and biking and scooters and all of that, needs to be designed, the system, in a way that is forgiving. No death or serious injury is acceptable, and that is really one of the main principles of Vision Zero, that we don't accept trade-offs. We are going to have to move around our cities and in our roads in the countries, but we cannot take for granted that we will have a number of fatalities and serious injuries. We are going to work endlessly every day to eliminate death and serious injury. And finally, to be proactive rather than reactive. We have over 1.3 million people that die every year, 50 million that get injured. We have tons of data, and when it's not perfect data, we still know our cities, and we know where the serious traffic fatalities or serious injuries have happened, so we can act on that. All right, so those are the principles, and they have to be heavily supported by the core elements, which is how are we going to implement this, right? Economic analysis, because when we work on road safety, the first question that will come to us is how much Vision Zero cost. It's too expensive for low and middle income countries, so we cannot do that. We have to do something that is simple, and that is a question that we should know how to answer and be really ready to have a strong economic analysis on that. There are few sources that are very important. The World Bank, for example, released an economic impact analysis on road safety earlier this year that I highly recommend to look at, because it has very important numbers there. The Koreans also 4 or 5 years ago did an analysis on the impact of traffic crashes on people that have been injured in traffic crashes, and the impact on that workforce that is normally young, male workforce is heavily impacted. Monitoring and evaluation, priorities and planning, very important. We are not going to be able to go to zero overnight, so we will have to pick what are our priorities, where we need to start working, and we will hear from different cities today. Bogota is online, Juan Pablo Carejo. We have Vision Zero here in Washington, D.C., and the work in Sao Paulo that is going to be telling us how they have prioritized and planned, and what is the system for monitoring and evaluating. Finally, 2 more areas: comprehensive governance and management. We know that because road safety is so complex, it needs to have many people that make big decisions sitting on in the table. And strong targets in data. That's also something that you see in Vision Zero plans that are successful. You start probably putting a 20%, 25% target, and then you work on that. In terms of the action areas, you will see that there are a few that are kind of new for our community. For example, land use planning. Because if we have cities that are sprawl, you naturally will have to use the private vehicle to move. And with that, the risk of getting into a serious traffic crash increases. Street design and engineering, well, this conference is heavy on that side, and we have the luxury of having IRAP with us, and Monica is representing today. Improve mobility options. We believe that a city, in order to achieve safety, also needs to be sustainable and needs to be basing their mobility in mass transportation, walking and biking. Speed management is key, as we have discussed. This is what kills us. Enforcement, laws, and regulations is something that we've been doing. We need to reinforce what we legislate here. Education and capacity building, in particular, because Vision Zero means a paradigm shift, right? We are shifting responsibility to decision makers, urban planners, transport engineers, traffic engineers. So we need to be fair with them, and we need to educate and empower them so that they know how to build this new system that for years we haven't been building without much regard for human beings. Vehicle design and technology, absolutely key. In particular, in Latin America, we have the work of Latin NCAP that is focusing on those vehicles that are designed with low standards and that are killing a lot of people, not only inside the vehicle, but also outside the vehicle. And finally, post-crash emergency response and care. When the traffic crash occurs, then we need to have a really efficient response. All right, so this is the framework that we want to present and we hope is useful for you. With that, I will start the conversation with our colleagues, and I'm gonna call Monica Olis-Lagers, who is a project manager for IRAP, to make her remarks. Thank you.
Thank you, Claudia. I'm greatly honoured to be here, and it's really wonderful to be in this wonderful city and to join with you all today to talk about Vision Zero and safer cities and 5-star cities. Now, you heard Rob in the first session talk about Vision Zero equaling 5-star cities, and I won't reiterate what Rob said, but there is one thing that I'd like to touch on, and that yesterday when I was going through the news here, I read that a 7-year-old girl, so a girl that's the same age as my daughter, was hopping off the bus and got hit by a car as she was crossing the road. The rule is here that the buses flash the stop sign, and so vehicles must stop, and a driver failed to stop and hit that little girl, and she's now in hospital in critical condition. And so for me, Vision Zero is a very real and personal thing. I've got kids out there, just like Rob mentioned, and it's so important that we pay attention to the road toll, this enormous toll that is happening every day across every city, across every country around the world, and it's a really important issue. But on that note, I'd like to show you a short video. I'll come over here out of the way. So today, thank you. The conversation is not just about us and what we do or what I do and what Rob does fantastically and the rest of the IRAP team, but it's also about you, and I want you to keep that in mind as we go through for the next 7 minutes. Vision Zero, it sounds like a really ambitious goal, unrealistic, some may say. But in fact, to understand where we need to go, it's really good to understand where you're at. And this is something that IRAP does offer. It offers real data. It's science. Road safety is not guesswork anymore. We know what causes crashes on roads. We know what affects severity of crashes. We know what affects likelihood of crashes. And so what we can do then is make the problem far more manageable. So a little while ago, I was on social media and I saw this little fact, which was 90% of the world's ocean plastic comes from 10 rivers. And suddenly, this thing that I had just had in my head that was a problem that was so big, it was as big as the world's oceans, came down to, wait a second, this is 10 rivers. If they can just fix those 10 rivers, we'll fix 90% of the problem. And it's the same in road safety. And so we have a big data tool that it groups data together from 350,000 kilometers of road assessments across 54 countries, I think. And when we go in there and we pull out the data from urban roads, so this is just looking at urban roads, and we can see that 70% of the roads that have 40 kilometer speeds or over have no footpath where pedestrians are present. We know that 94% of roads where bicyclists are using them and they're over 40 kilometers an hour of speeds have no bike lanes. And we also know that 89% of roads where pedestrians are crossing them and speeds are over 40 kilometers an hour have no crosswalks. So suddenly, like, how big is the problem? If we can fix this, we can fix the enormous road toll in cities. Pedestrians in cities for high-income countries make up about 20% of overall road deaths. In low and middle-income countries, it makes up anywhere between 50 and 80%, occasionally higher, sometimes a little bit lower, but that's the typical rates of road deaths for pedestrians in low and middle-income countries. And it's a very real problem, but we need to just change the mindset. We need to actually change the conversation we're having. Vision Zero offers a step change in how we think about the problem. It's suddenly testing our tolerance for how many people we're willing to lose on our roads. And it's quite powerful to be able to reduce it down to a few key points and say, if we address this, we can fix a huge part of that problem. And we know how. We have the tools. We can show you. We can invest in those roads and we can show exactly how much benefit you'll get, how many lives you'll save. So Vision Zero does offer a major shift, but that shift now is being accompanied by a really big shift across how roads are being used as well. And it offers us an enormous opportunity. So it's not any longer roads being a relationship between road authorities and private vehicle owners. We've got service providers in there that were never there before. We've got technology, we've got data. We've got a whole range of different stakeholders entering this conversation, many of you here. And it provides us such an opportunity to think about this problem differently and to address it differently as well. In Beijing, when I arrived back in 2015, I ride a bicycle, love bicycles. No one was riding bicycles. I was one of the few. And then by the end of 2015, Mobike arrived and had filled the city full of bicycles along with all these other share bike providers. And it was so amazing to see the relationship they had in sharing data with the city. And that's now happening with Didi, so the Chinese equivalent of Uber. And the city is taking road safety really, really seriously. In fact, every time I step out my door, there's a new bicycle path. Sometimes it moves overnight because from one reason or another it didn't work that place and so they moved it over there. But everywhere you go now, there is really good quality infrastructure, and that has happened as a result of this data sharing and these new players entering the market, essentially. I'd like to touch on our innovation framework, because I don't have much time, but we have some really great initiatives happening, and in order to change the conversation, we've got to make sure that the tools that are available and that are using we've got IRAP core models that provide star ratings for different road users, but now we also are able to put those into tools like the Star Rating for Schools tool, which puts this information into the hands of school communities. We have Star Rating for Designs that's putting this information into the hands of designers, road designers and engineers. And as we're going along, we're developing CycleWrap for cycling infrastructure. We're also looking at intersections and creating an intersection module to address those key points of risk on a road network. And so as we go along, we're building up these programs to try and get information into the hands of those people to change this conversation, change it with policymakers, change it with road planners and designers, change it with road authorities, but also changing it with the people who use the road, the service providers, the data collectors, the average person who just wants to get from A to B. And that's where one day, I hope that when you pick up a phone and say, okay, I need to get from A to B, how do I do it? It's not going to show you just the quickest route, it will show you the safest route. But we're already partnering with many of you in this room and organizations across the world to develop these tools. They will be so much better and be so much more effective with these partnerships. And indeed, we're already realizing that, and they're coming to life, which is fantastic. And so I encourage you to have a look at this, and I hope out of our conversation today we can explore the opportunities where what vehicle, in order to collaborate on these things, is there? What ideas? How do we effectively collaborate? How do we take these things forward? Where are the opportunities? And that's where I'd love to hear from you today. Thank you.
Thank you very much, Monica. Beautiful video. Thank you for bringing it. Jonathan Rogers is the policy analyst for the District Department of Transportation of Washington, D.C., the city that you are visiting or you live here. So welcome, Jonathan. Thank you for joining us, please.
Thank you so much for having me, and welcome to Washington, D.C. if you're visiting. I'm Jonathan Rogers. I work at the District Department of Transportation, which is the local Department of Transportation, so not the federal government, but like the city government here in D.C. So you can look at the road safety outside as you're visiting. If you have any feedback, as always, please come talk to me about anything you see. Is this my clicker? Great. So here in Washington, D.C., I want to give you paint a very quick picture in 10 minutes or less of what Vision Zero looks like on the ground here in D.C. We have I'm very fortunate to have great leadership here in D.C. Mayor Muriel Bowser committed to Vision Zero about 3 years ago. So we're aiming for the year 2024 that we will eliminate all serious injuries and fatalities. Our transportation director, Jeff Marudian, is also strongly committed to Vision Zero. It's really his #1 priority since he's been the director. And so as an agency and as a city government, we're very much committed to Vision Zero. So that's wonderful for someone trying to implement it. So this is a photo I took when I made my first visit to an IKEA, like last summer, I think. Everybody's familiar with IKEA. It's a Swedish company, in fact, which is a little ironic. We didn't collaborate on these presentations, but I think I'm going to confirm everything that Claudia and Monica said so far. This is basically the opposite of Vision Zero. I don't know if the Swedes are teasing us here in America a little bit with this, but so this was just in like the children's section, not like bicycling or anything like that. And these are safety vests that, if you can read the little plaque next to it, it says, "Put this vest on your child when they go outside so they can be safe and visible." And it has the high visibility color and the reflective stripes, and again, you heard those Vision Zero principles. This is really the exact opposite. It's putting all the emphasis on individual responsibility and decision-making of a child and sort of taking all the responsibility away from the system designers and saying, hey, it's not safe out there. You better put your kid in this bright vest or else it's kind of your fault if something bad happens. So Vision Zero, as you heard, is the opposite of that. Starting from the paradigm shift of no loss of life is acceptable. We know people are going to make mistakes. All the responsibility should be almost all on the system designers so that the system is forgiving and sort of predicts and makes those mistakes non-fatal or non-serious injuries. So again, I think from someone who's implementing all of the principles you heard about of Vision Zero, it comes down to the 4 E's, people often call them, of engineering, evaluation or data, enforcement, and education. And I think they're in emphatic order there. Engineering is really the foundation for us. It's at a DOT, I need to be building and designing and operating and maintaining safe streets. The data is very much hand in hand with that because I need to know where to do that and how to do that. And then sort of the backup plan and supportive tools we have are enforcement and education. But really, it's about designing safe streets. Here in DC, like I said, we are aiming for the year 2024. Recently, we've been around 30 fatalities per year, so we don't have a lot of time. It's great that we have the urgency built in there with Vision Zero, but in 6 years or less, we need to be down to 0 from 30 if you're talking about fatalities. So I think like a lot of other cities in the US, we have our work cut out for us, but we have that goal now. It's very clear. We have a date to hold us accountable. So I think that's helping building the support, treating this like the public health crisis that it is, instead of sort of an abstract, lofty goal that no one's really pushing for or paying attention to. Again, the data is so important. We've heard already today that you need to know where you are if you're going to get where you're going. So we know who the fatalities are happening to in the district. You can look at just which modes of transportation they're happening to, but I think even better is to look at how those modes are being represented and compared to either, if we knew every single trip everyone took, that would be great. We have on the right there just every commuting trip by mode, and then the fatalities by mode on the left over 5 years. And you can see in red, pedestrians, it's a pretty high share of commutes here in DC at 14%, but yet 40% of the fatalities are pedestrians. So that jumps out at me. The same for motorcycles being only about 1% of the commutes, and maybe there's more other trips than just the commutes, but 15% of the fatalities. When you look at the bikes and then motor vehicles, those are maybe more what you would expect, but so there's some clear overrepresentation and maybe more vulnerable users, you could conclude. And then again, as you heard, we have a small number of streets that are our problems. So in addition to the who, we need to know where. And so a lot of Vision Zero cities like ourselves have looked at like a high priority network, a high crash network of streets. We have a problem with our arterials, which probably have those higher speed limits, 35 or maybe 40 here in the district, miles per hour. And so again, we have 15 of those that accounted for more than 50% of the bicycle and pedestrian fatalities over those 5 years. So that those are some clear priorities and sort of locations to focus on. What about how? How do we build safe streets? In the US, a lot of progressive cities look to NACTO that have wonderful urban design guides for actual street design. So that's one resource I would recommend, and I think we try to aspire to. And here's some images of what that looks like on the ground. So on the left, you see before, this is right by Union Station, near where WRI is. On the left, you kind of have a normal street maybe. On the right, now we have a protected cycle track. We have a shorter crossing distance for pedestrians and that nice crosswalk. So it's more of a complete street than it was before. Here's an example in one neighborhood in DC that really just requires some signal timing and paint, and it's something that US cities used to do more often, a Barnes dance, where now the pedestrians can cross diagonally. There's a phase where only pedestrians can cross, so you eliminate turning movements from cars. So that's actually a pretty simple thing that used to be more common in cities, and we have 2 of them in DC now. LA actually has some really good data on locations where they've done this and haven't seen a fatality since where there had been prior. So That's a good example. Here's another intersection that was just really confusing and I think has no separation for any modes. Nobody knows really what they're supposed to do, and there's a lot of open space to go fast. We changed that to this. So this is a big capital project where we really reconstructed the whole intersection, but now there's a protected bike lane, there's much easier pedestrian crossing, and it's much more simple for people driving to know where they're supposed to be. A bit of a road diet maybe, but it's really not creating congestion or anything like that. So that's, in a perfect world, our intersections would all look more like that. We have some retrofitting ideas, making it easier for people to cross, especially mid-block where maybe there's not a signalized intersection. We add things like hawk signals, they're called here, where a person can push the button and have traffic stop so they can actually get a red light. So there's a walk signal for them to cross. And sort of the little brother of that is the rapid flashing beacon, which just calls attention to drivers with very bright LED lights that a pedestrian has the right of way to cross on that crosswalk. So these are retrofitting ideas. Another thing New York gets a lot of attention for, we have it here in DC, is the leading pedestrian interval. It's pretty simple, again, the signal timing at the intersection where you see that walk signal comes on a few seconds before the vehicle traffic would get the green light so that they're not trying to turn right through the crosswalk when a pedestrian's also walking straight and has the right of way. So that's reducing crashes, and we have it many intersections, and it's a good example of something we're trying to do the safe systems approach with. So not just finding an intersection where that was a problem and only fixing that intersection reactively, instead be proactive. We know this is something that's safer, so apply it to the whole system. It can be even simpler. You can do a lot with paint and plastic. So this is an example of where we've closed some slip lanes and areas where vehicles could make high-speed turns and cross multiple lanes of traffic. So it was really just complicated and unnecessary and kind of over the top trying to accommodate motor vehicles. And instead, we've created some public space that maybe some amenities could be added to in the future. And it's easier for people to cross. I think simpler for people to drive as well. Neighborhood slow zones is another concept we're working with. Again, I don't think you only want to change the speed limit. Like just changing the number on a sign might not change behavior or make it safer. But I think this is an example where you see a traditional bike lane, but it's kind of scaled appropriately, where the 20-mile-per-hour speed limit would feel right to drivers. It's usually 25 by default here. There's ideas like that. I went to Amsterdam and Copenhagen last summer. And so, they're often hailed as having the best bike infrastructure in the world. I just want to point out that infrastructure alone can't do everything. Here you see someone blocking a nice bike lane in Amsterdam, same thing in Copenhagen. So you need things like enforcement, even though problems go along with that. So we have a lot of photo enforcement in DC. Data to us also means public input, so we do a lot of that here in the district as well. And then education is okay too. Again, it's sort of the backup plan. So we teach every second grader traffic safety and how to ride a bike here in DC. And even safety campaigns are okay. So we have those too. We're not only doing that, but in addition to literally educating people about how to use the street safely, we have these campaigns to remind them of what they probably already know. So those are all the E's, and that's sort of a crash course in what we're doing in Vision Zero, no pun intended. Thank you very much.
Thank you. Thank you very much, Jonathan, and thank you for making the city where many of us live safer. Thank you. And with that, I would like to introduce Sergio Aveleda. Is our new Urban Mobility Director at the World Resources Institute. So Sergio, please.
Good morning, everyone. It's a pleasure to be here. I'd like to thank to the IDB for this invitation. And I will try to discuss with you some aspects about Vision Zero, considering my former experience in São Paulo City, where I was Secretary of Mobility and Transportation. In our countries, Brazil, Latin America countries, low-income countries, yes, here, we need to emphasize about economical aspects when we are talking about fatalities in traffic. Of course, when we are talking about save lives, reduce injuries, improve safety in the traffic, it is the enough circumstance it should be the enough circumstance to engage people. But unfortunately, some people need to be involved by economical aspects. And in low-income countries, money is, especially in the public sector, is a huge restriction to manage the public budget. So when we show the economical aspects to implement this methodology, this Vision Zero, we can improve the quality and the quantity of the engaged people in this methodology. In Brazil, the federal government agency, IPEA, the public institution responsible to economical studies, showed a study, published a study in 2015, and they consider in Brazil, we lost more than $11 billion per year in traffic fatalities. It's a huge quantity of money for Brazil. We could improve the infrastructure, the public transportation, the sanitation, the house programs in Brazil with this money. The World Bank published in the same way a study in 2000. I don't know, I'm not sure about when this study was published, but they published low-income countries, if they reach to reduce 50% of the traffic fatalities, we could improve GDP in these countries between 7% and 22% in over a 24-year period. When I was secretary, and me and Claudia, 2 years ago, we started to talk about Vision Zero in São Paulo. I listened from someone, especially people from financial sector in the city government. We intended to spend more money in this program. You don't have money. We don't have enough money to improve our education level, health services, sanitation, and you intend to spend money to improve the quality of the streets. And we showed for these people, we are not talking about new expenditures. We are talking about making money, saving money directly in the budget. And with these arguments, we increased the engagement in the city government for this program. The second aspect I would like to discuss today is one point I think we miss when we are talking about the safety road. When we are talking about public transportation, we discuss a lot about gender aspects. But we miss to do it when you are talking about safety, injuries, deaths in the traffic. And I think it's a very important point. In São Paulo, 52% of the drivers who has the license in the city are women. But 92% of the deaths are caused by men in the traffic. With this number, with this data, we can manage to reduce the number of the fatalities. I used to say when I was secretary in São Paulo, if I could prohibit men to drive, I could reduce 92% of the fatalities, of the deaths in the traffic in São Paulo. First of all, we could encourage public fleets, for example, the public buses, to contract more women to drive buses. If you do that, you contribute to reduce the fatalities in the city. Private fleets could be encouraged as well to contract more women. You will act to create more job opportunities for women, and you will contribute to reduce the fatalities in the traffic. In São Paulo, we regulate the ride-hailing companies, and we ask them to pay to use the streets and the avenues in the city. If they use the streets a lot, they pay more money for the city government. But we created some discounts. One of them was, if the travel was made by a women driver, they receive a discount in this fare. So we are encouraging these ride-hailing companies to authorize more women to drive their cars. And I think it's necessary to consider this aspect, this gender aspect, in our communication programs when we are talking about to reduce fatalities in the traffic. We need to speak, to address to men, your behavior in the traffic is not a power demonstration. It's not a well behavior. It's a weakness demonstration. Australia has some videos in very good way in this aspect. We need to talk about this difference because women drive in a very practical way to transport me and my family from point A to point B. But usually men create a narrative to drive, to demonstrate power, to demonstrate strongness. And you need to change it if you want to reduce fatalities in our cities. To finish my first participation in this panel, when we started to talk Vision Zero in São Paulo, I listened from someone two things. First of all, especially from some traffic engineers, we don't have governance about traffic fatalities. It's an individual behavior. We need to change the behavior of the drivers. If you reach this, to change this behavior, we will reduce fatalities. We are not responsible for fatalities. We put signaling, we put lights, but they don't respect it. And I think you need to be more connected with the aviation. How the aviation reacted when they have an incident or a fatality. They don't accept any incident or any fatality. And they considering all the stakeholders are responsible for that event. We need to construct it the same way and to convince our traffic engineers, especially these people who remain this vision. We could use the aviation as an example. In 2017, we lost only one person inside in a commercial airplanes. Only one person dead in a commercial airways during 2017 because they are involved and they considering everyone responsible to reduce and to prevent these events. And the second thing that I listened was, it's a utopia, Vision Zero. We live in a city with 11 million people, 5.5 million cars, private cars, 15,000 public buses, 1.2 motorcycles licensed in the city. And you are planning to eliminate the deaths and the severe injuries in the traffic. When I listened to it, I remembered an Uruguayan author, Eduardo Galeano, who wrote this phrase, "Utopia lies at the horizon. When I draw near by 2 steps, it retreats 2 steps. If I proceed 10 steps forward, it swiftly slips 10 steps ahead. No matter how far I go, I can never reach it." What then is the purpose of utopia? It is to cause us to advance. Vision Zero pushes us to advance. Thank you very much.
Thank you very much, Sergio. Thank you very much for remembering us that utopias are important, that help us really guide our energy and our force. And with that, we have one more panelist, and he is in Bogota, and he's listening to us in this moment, Juan Pablo Bocarejo, the Secretary of Urban Mobility of the City of Bogota, will join us
So we are testing all the systems. Very good. Juan Pablo,
Good
can you hear us?
I can hear you perfectly. How about you?
We can hear you really well, Juan Pablo. Thank you for joining.
Thanks for the invitation. Thanks to IDB.
Wonderful. Please.
We're very pleased to be with you and with this spectacular panel talking about road safety.
We are very happy that you are able to join, Juan Pablo. I let you start with your presentation. Thank you.
Thank you. Road safety, road crashes, road accidents represents nearly 1 point of the GDP of Bogota. Of course, that's not the important issue. The important is that it is a very complicated health issue in our city and in our country. As you may see, we've been having a very complicated and long armed conflict of decades, but the number of people that are dying on the streets are far worse than the people that died in the armed conflict. So it is a very serious conflict that we are having. And in Bogota, we've been struggling a lot, and it has been difficult to change the pattern and the number of injured and people killed on the streets. Here you can see sorry, we have some technical problems. So here we can see how Bogota is doing compared to other cities by the number of fatalities by 100,000 inhabitants. So we're not doing so well. It's 6.8. And we have a lot of progress to do. I want also to show you how these interactions are occurring now in cities and what are the actors that are more vulnerable to this health issue. So at first we have the pedestrians. Pedestrians account for almost half of the fatalities. And it is the interaction between the pedestrians and the motorcycles that has been the most important. There is also a concern about pedestrians and automobiles and buses. But what worries us the most lately is the situation between motorcycles and all the other actors, especially trucks and buses. So those are probably one of the most critical interactions we are facing now. We have been working with a wonderful network of allies on road safety. We've been working with the BIGRS network, with Bloomberg, with IDB, with WRI, with a lot of partners, wonderful partners, and we've learned a lot of methodologies, a lot. We've been discussing a lot about policies, and I think we're improving in many fields. The first one I would like to mention is the institutional field. I think that our engineers, our psychologists, our sociologues that work in the road safety unit here at the Secretary of Mobility are very enthusiastic, empowered, and they are doing a great job. We have been building a long-term policy on road safety, and it's based on Vision Zero. We've been receiving a lot of information, a lot of new knowledge, know-how about how to implement this Vision Zero in Bogota. And hopefully, I think we will make a good progress. One of the key policy tools that we've been implementing is the road safety plan. The road safety plan was signed by Mayor Enrique Peñalosa last year, and it should be implemented for the next 10 years. It includes, of course, a holistic approach, including engineering, education, enforcement, and it's really based on the Vision Zero policies. We've been working with a lot of allies. Probably that's one of the things we are most proud of, is that we've been succeeding to have companies, big companies, institutions, a lot of actors on the private and on the public sector that are joining us in a network to try to improve their road safety behavior. We've been implementing some kind of prizes related to the idea they have in improving road safety in the companies. One of the key companies that are working with us are bus companies, taxi companies, truck companies, and I think we've been able to put everyone on the same wave about road safety and about trying to bring new ideas to the table. We've been working also a lot with public awareness. You can see there an example on how we are using the social media. This is an information that we give every day, and it's what happened the day before with road fatalities. So at that time, we had already 99 days without people killed on the roads. And we have a strong support from our mayor that is also giving information to the community about what's happening in terms of road safety accomplishments. Of course, we are working on safe infrastructure. We've been having a lot of help from the partners, for example, IRAP with the diagnostic of where should we work on the main street, NACTO about placemaking. So you can see there are some pictures about before and after actions. in very critical areas where we have a lot of accidents. We've been working a lot on school zones. So we've been implementing more than 2,200 school zones, reducing speeds to 30 kilometers per hour. Reclaiming spaces for the people. So we've been working that especially with NACTO, developing plazas. Before we had parking zones, now we have plazas for the people. That is helping a lot. And probably so a lot of infrastructure for the cyclists. Probably Bogota is the city in Latin America with the most kilometers of cycle infrastructure. And I wanted to show you some of the results we are getting from these policies. This will be 2018 will be the year we will have the less pedestrians killed on the streets. We will have a reduction of 29 people compared to 2017. That means a 13% reduction. In terms of young people, children, we will have a reduction of 33%. It will also be the lower number in the past 10 years, and also related to elderly. 17 lives saved, a reduction of 18%. We're starting a new program about speed management, and we are very excited about the results. We have decided to reduce speeds from 60 to 50 kilometers per hour limit in 5 main roads. Those roads account for almost 25% of the fatalities in the city. And it's mainly vulnerable users, 85% of the killed are vulnerable users. This speed management will include next year cameras and a lot of technology that would help us to enforce the measure, but it is already giving us some very good results. This started in October, and this month we will have a reduction of almost 83% of people if we compare with October last year. Last year we had 12 people killed on those 5 corridors. Now we had only 2. And one of the most critical corridors that we call Avenida Boyacá has always been the worst every year after year. And we've been able to have 0 deaths this October. So I think this is working. We are telling the people we just want you to reduce speed, so we are making the control very visible. And for the moment, even if it's not very popular, I think that they are accepting this reduction because they can see the results. We are working a lot in communication and education, also having an important help from our partners. We've produced some commercials and information for the people on the streets related to how to change behavior. So we're trying to introduce a lot of different campaigns, lately working a lot on pedestrians, trying to raise concern about the fatalities and how this is a health issue, probably one of the biggest in Bogotá. So we are working with all the key actors, for example, the bus drivers, the cyclists, etc. That should be mainly what I wanted to show you today. Thank you.
Thank you very much, Juan Pablo, for joining us. And thank you especially on behalf of all those families that are going to have their beloved ones going back home, for being brave and moving into reducing the speed in Bogota. We know it's not easy, but really well done. Thank you very much. All right. So with that, we still have 10 minutes for a discussion, and I just would like to check if we have any questions from our colleagues online. I don't see to have anyone right now, so we are going to start with few questions that we received previously. And one question for Jonathan. If you could change one thing about the way Vision Zero is being implemented in your city, what will it be?
Tough question. I think first I just have to give credit to any elected official who has committed to Vision Zero, because I think it's a really it's a big task for them. It's kind of inviting a lot of criticism on them, because they have to not only make up for generations of not as effective transportation design and operations. Then they have to say, we're committing to this goal maybe by this specific year. And so every year we're not exactly at zero. You can criticize me, you can tell me we're not doing good enough. So I think that's a really courageous move for an elected official to make. And so naturally we do want people to hold us accountable and to be, build that urgency for everyone to, treat it like the airline industry or anything else, like that we won't accept serious injuries and fatalities. And so that's very helpful to have that support and that culture change. But I think it's really difficult to maximize what the advocacy community can do for Vision Zero. I think if I were to change something today in DC, it would be to get more out of the advocates who I think are very committed and engaged with holding the city accountable. But I think we end up getting into sort of a little finger pointing, sort of like we're more focused on what's not going well, when we really both want the same things overall. There's a lot of consensus in DC in all the branches of government, and I think among the public, like photo enforcement I talked about earlier, even though that gets a negative perception, surveys have been done in DC that actually most people support it. So people are on board with Vision Zero, whether it's for economic or environmental or just for safety reasons. And so I think we need to work on making that advocacy more effective, breaking it away from just modes of transportation. Like a lot of our advocates are either perceived as bike people or just pedestrians, and so it's easy to sort of push them aside and say, well, you're just fanatical people who are into that one issue, and this doesn't really affect me as just a driver or the regular person. So I think making it something that's about everyone and working on what we all want to see happen, as opposed to just pointing out the bad things.
Very good. Very important. As you are saying, it's very brave of a decision maker to make this as a very important policy, because people will hold you accountable and there is a lot to be done. Monica, how do you know when Vision Zero is being achieved? What are the metrics for success according to your work in IRAP?
It's a really great question, and I think it touches on your point, Jonathan, about any elected official who stands up and says we're committing to Vision Zero then opens themselves up to constant criticism for every year that Vision Zero isn't achieved. And I think being able to use the tools that are available out there for infrastructure risk assessment, and so for IRAP it's 5-star cities, it provides a more positive, proactive measure that enables elected officials to get out there and say, we have upgraded X% to 5-star and X% up to 4-star, and also focus on the road user groups. They're able then to understand the problem to know where the deaths are happening, where the highest risk roads are, and to address those. And so for something like Vision Zero, when we do actually have limited resources, it's just a very real world issue. Everybody's got limited resources, but being able to channel those resources very effectively, being able to target the investment toward the 1- and 2-star roads, and to target those road user groups that are suffering more so than others. And so we can focus, for instance, around transit stops and going back to Rob's map that he showed earlier, where we look at, okay, we have transit hubs that have enormous numbers of pedestrians and we have problems. We can make that a 5-star precinct, and then we can move on and make this a 5-star corridor, and then it grows and we can eventually reach 5-star cities. But once that happens, we will start noticing the drops in those road deaths. We can take the worst ones first, and we will get the biggest drops in road deaths, and then we can, as we go along, we can work on those more problematic areas and the smaller areas.
Very good. Thank you very much, Monica. And Ana Maria, we have heard for many years that there is no demand for road safety. What do you think? Do you see in Latin America, in the Caribbean, more interest and more demand for road safety?
Definitely. I will say that that even though we haven't reached the goal that reducing the deaths in the region and in the world, I will say that something that we have all accomplished is that if we reflect back from 2010, where we're now is in the agenda, is in the political agenda of, I would say, almost every country in the region. We have all the societies active, not just the policymakers or the governments. We have NGOs, we have the civil society. So I think one achievement is that we have helped between all of us to raise public awareness. And I think it's a problem that is recognized, but it's not enough. And as we've seen in the numbers, it's our best indicator. We haven't reduced it, so therefore we've not been effective. But I feel there is a huge demand at the moment, huge demand of knowledge, of technical assistance. The governments come to us and say, well, how can I start? I think we have all done a lot of work of helping governments to make plans. So they all have the plans, and I think we have to reflect as well on what else are we going to give? There are no more consultancies that make one plan after the other, no more paper, and more evidence-based interventions, as we've seen from Juan Pablo or from Sergio. I think we just need to help cities and governments to prioritize on which are those effective measures, because sometimes as well, we all come with these lots of information and different tools that everybody that been in government knows that you just can't do so much, and you have to be prioritize and take small actions that have big impact. You cannot do everything. Some have political cost or financial cost or just technical human effort that you just cannot do it with everything that is in place. But I will say that not to congratulate ourselves, because it's not enough, but I will say that something that has been done is like awareness, and as well like institutions. I think we have now institutions or responsibles in every country, city, that now are like at least in charge, because it's not just one institution, but at least someone is accountable now for road safety. So now what we have, and this is why I said that now the demand that we have is, okay, so how can I do it? How can I get there? And we've seen how it's done. I know in countries that maybe don't have the same culture that we do, and maybe know the same things will work. But I think we have some examples in the region, and now we have to like go and work for, targeted and maybe tailor-made for each city, and help them to build them themselves. But definitely, I think more than ever, there's a demand of resources and help.
That's wonderful. That makes us all very hopeful.
Yeah.
Thank you, Ana Maria.
We cannot stop anyway. I mean, the numbers don't let us.
That's right. Thank you.
We got a question from the National Agency for Road Safety in Colombia. So please, to all of you, what are the type of measurements that you know are being used to promote women to be drivers of public transportation? Do you know any that in particular is helping to get more drivers or not yet, and that has to be part of the agenda?
In São Paulo, we created a program to encourage the private operators, because the public transportation system in São Paulo is operating by private companies. It is around 32 different companies. And you create a program to encourage these companies to hire women to be driver. And that companies that hired women, the numbers are very interesting in terms of fatalities. In terms of incidents, they reduced a lot the costs of the operation, and they reduced a lot the number of the incidents with the buses. I think it's in the hands of the public authorities. They need to create programs to encourage companies, and if the public authorities operate buses, they could put it directly in these companies. But if they contract the private companies, they could regulate these contracts to encourage these companies to hire women to be drivers.
Very good, and we have data backing that up, so yes. Go ahead. Finally, Juan Pablo, if you are still there, can you hear us?
Yes.
Thank you. So we want to know a little bit more about the process of having this road safety plan in the city of Bogota. What was the process with other decision makers in the community to develop the Vision Zero plan? Were they being included? Tell us a little bit about how is to build a Vision Zero plan.
You know, we started with something very basic, and it was trying to improve some specific spots. And you had two kinds of stakeholders. The people who lived there and who used to walk, they were asking us a lot to make speed reductors. And the people that went into their cars, they hated it. So it was just trying to bring the people who was with us in the idea to reduce speed and make them speak louder. We also had a very important stakeholder that finally started to work with us, and it was the people on motorcycle. The fatalities were so high for the motorbikers, and we decided to start with the road safety plan for the motorbike. CAF and other allies helped us in this plan, and the whole idea of the plan was ask them what they need. It was the problem of the motorcycles in Bogota was totally new, and talking to them helped us a lot. Then we started also to work with the companies, as I said, and building this network of people worried about the accidents they are having when they move their goods or their people, and how that has an impact finally on the finance of a company. So a lot of, we could manage to find a lot of people interested in reducing road safety. For a long time, road safety was totally ignored by Bogota people. And I think we still have a long way in order to really have everyone in the same culture against against fatalities and risk. But I think we're doing a good progress, and it's bringing people to think that Vision Zero is a good idea.
Excellent. Thank you very much, Juan Pablo. And we're a little bit past our time, but I would like to allow the audience to ask
two questions. If there is anyone, please, the gentleman here, and Eugenia Maria. We are going to be available outside. We don't have a lot of time, so apologies for that, but please, go ahead.
I am Sanjay Nirmal from Delhi, India. In fact, one of the very important measure which we found very important in road safety in the city of Delhi was introduction of traffic calming measures. Because as we all know, the speed control is very, very important element in particularly city. And after introduction of various traffic calming measures, and in fact, Delhi city is having a lot of roundabouts, and that is also a very safe device. And in fact, we have prepared another standard which has been updated further. And we found that over the year, from 2015 to 2016, we found a reduction in the accidents. In 2016, the number of people killed in Delhi alone is 1,590, which was about 5% less than the year 2015 after introduction of traffic calming measures. So we have come out with the new guideline, and that is taking care of the cities as well as the rural areas. So this is a very important element in the city. Thank you, sir.
Thank you very much for bringing the example of New Delhi, and I'm aware that New Delhi is coming up with a comprehensive road safety vision plan that has the principles of safe systems as well. So congratulations for all your good work. Eugenia Maria?
Hello, good morning. Eugenia from Pan American Health Organization. My question is for our colleague from DC. So how you are planning to face the scooter, the new challenge that we have in this city that's increasing. And so I have this question on my mind every day when I'm walking around.
Thank you. Thank you for that question. So I think one way to look at all the micro-mobility, you might call it, whether it's the new kinds of bicycle share systems that we have out there, which for us, the scooters are part of that. We think a great Vision Zero strategy in general is getting more people out of cars and reducing vehicle miles traveled in cars so that, again, when there are crashes, if they don't involve motor vehicles, they'll probably be less severe. But I think there are some legitimate concerns about scooters in particular, at least the way we've seen them being used in DC so far. And these are like stand-up electric scooters, not like a motorbike or a Vespa, that kind of thing. And so in the district right now, by law, they are allowed on the sidewalks outside of the downtown, basically. And so we do hear a lot of concerns from pedestrians about the speed they're traveling, especially on the sidewalk. So that, there's, I think, much like every other sort of example, whether it's the safety of the vehicle or the education of the people using the vehicles, or the enforcement of the rules around them, I think we're actively looking at all of that. But I guess just my gut reaction overall is that probably more people on scooters is a good thing compared to more people driving more. So not to downplay, interactions and safety concerns with pedestrians and people on scooters, or even people themselves getting hurt on scooters, maybe in crashes with motor vehicles. So I think there's details for us to work on, and we're evaluating that over like a pilot program that we're doing now. But I think we think the active transportation limits risk more than promoting motor vehicle trips. So.
Very good. Well, thank you very much to all of you. Thank you very much, Juan Pablo, Ana Maria, Jonathan, Monica, and Sergio for joining us in this panel this morning. We have finished the program in the morning, and we are going now to have a break for lunch. We are returning at 2 p.m. Thank you so much for joining us.